threw up a handful of charts in the presentation that sort of struck me. And I think it was based on the question of, does the EHR enable high quality care, essentially? And then you had the response across 100 and I think at the time it was like 133 organizations. And the crazy thing was just the disbursement of that. And then you kept breaking it down. You said, well, maybe it correlates on the platform. And as you said before, there's an Epic implementation that has a lower percentile and there's one that's at the top percentile. You said, well, maybe it's academic medical centers, maybe it's children's hospitals. And you just kept breaking it down. I mean, did that stuff surprise you? I mean, give us a little feel into that those specific metrics on the EHR enabling quality care.
Yeah, let's touch about this, because we actually just worked with Chris Longhurst at UCSD and a number of other leaders in the ARCH Collaborative to submit a paper to the Journal of Applied Clinical Informatics. And we got a rejection, and I think we're going to resubmit. And one of the referees said, look, everybody knows it's the software. and the challenge that I have with that is that if the software was the key driver of success for an EHR implementation, and I'm not going to argue the other side that it doesn't matter, it matters. But if the software made or break, were the make or break factor of success for your users, then we wouldn't see high variation within a customer base. We would see most Epic organizations scoring in about the same place, and most Cerner organizations, Athena, Allscripts, and Meditech, and down the road. But that's not what we see. We see this huge disbursement, as you say, and we see some Epic organizations scoring higher than some Cerner organizations, and vice versa. And we see this huge variation. We do see some EHR platforms that we have not really measured a successful user group yet. And so the EHR does make a difference. But the variation is very, very telling. So then you look at it from an organization standpoint, and you say, maybe it's the type of organization. Maybe it's children's hospitals versus academic versus large versus community hospitals. And look, we found a successful type of organization of every type. And actually, the organization type doesn't make a big difference. We do find that organizations outside of the U.S. Tend to be a little bit more satisfied, but they can also be incredibly unsatisfied. So currently, the least satisfied organization that we've ever measured using Epic software is an organization that's outside the United States. So, there's just a lot of variation that goes into this, and really what it comes down to is, we believe that we're building checklists and learnings and things that are helping organizations focus on what matters most. But at the very end of the day, an EHR is a leadership test. It is a test of leadership and teamwork and joint effort and culture to be able to see if you can work together and make this thing work. And if you don't have the leadership in place and the teamwork and everything that you need to, then it's going to not work. And it doesn't mean that you can't improve your leadership, and it doesn't mean that you can't improve your teamwork. And a lot of times the insights from these users identify those opportunities.
Is there correlation with, some of the things, as you threw them up there, I was wondering, is there a correlation with budget, the amount that a system budgets, or is there a correlation between size of the organization?
Okay, so hold on a little bit. It's not a statistically significant correlation, but organizations spending more tend to have slightly lower satisfaction. That's how the regression line lands right now. So it's slightly negative. Although we do see on the tail, there's a few organizations, if you're spending less than 3% of your operating budget on IT, you tend to have a little bit lower satisfaction. So there is a group that's really low satisfaction because they're just not putting enough resources into it. But by and large, there's a lot of organizations that are in the very same range in terms of how much they're putting into to their EHR and into IT, and they're getting very, very different results. We don't see your most satisfied type of organization in the United States is a multi-hospital community health system. So a health system of around 500 to 1,500 beds. That's going to be your most satisfied organization. But that's not worlds better than other organizations. But they tend to have a little bit more scale to be able to support things, but they also tend to be a little bit closer to some of their users to have some of the teamwork. But we've seen very large organizations be quite successful, and we've seen very small organizations be quite successful. But when it comes to investment, I don't think we should be very surprised. I shared this at I shared this when we were presenting at a time, I believe. But there's a great post from Nate Silver, the 538 website, and he talks about how, even in baseball, where we have so many statistics and so much data, baseball 30 years ago was really bad at spending more money and getting a higher win rate. And there was a very poor correlation, and it's gotten a little bit better in the last 30 years, which is kind of bad for the game, but we won't go there. But the bottom line is that this is hard stuff to do, to spend money in a way that's really going to make a difference, and which is why, look, if you go and measure with the Arch Collaborative or you measure with somebody else, just measure. Don't keep moving forward with what you're doing. And if the Arch Collaborative can help with anything, we would like it to become absolutely unacceptable, because we believe that it is unacceptable to move forward as an IT organization and not measure the feedback of your users, because you just don't know what you're spending money on. It's a little bit reckless to not measure at this day and age, when any organization, even if you don't do it through us, could just build a survey monkey survey and send it out to your users and collect their feedback. This is just something that should be standard practice in the industry, and we think will dramatically improve the experience of clinicians using their EHR technology.